Hospitals are really facing a big surge in new COVID-19 patients, and that means added pressure for healthcare workers already feeling overworked. And with more of them getting sick, it is leading to staff shortages. For more, I want to bring in Doris Grinspun. She is the CEO of the Registered Nurses Association of Ontario. Doris, good to see you as always.
Thank you, Jennifer, so much.
So as we see yet another surge of cases and hospitalizations and healthcare staff really coming under pressure, how are nurses feeling right now?
They're feeling overstressed, but more importantly, on the area of what we can do, given the so little too late decisions, is they're feeling extremely abandoned. Abandoned by this premier. Jennifer, you have no idea how many phone calls I have left. This is a premier that used to call me back all the time. He's ignoring nurses because he knows what he's doing. He's taking photo ops with empty beds as if he can open more beds. He's not answering the calls. Minister of Health, Christine Elliott, is also not answering my calls as of late. It's a disgrace. They are abandoning nurses. CEOs saying in national television that nurses, instead of 3 to 5 patients, are having 10 patients. Just picture that. Picture the safety for patients and the moral distress for nurses being left on that situation. We said to the premier how to fix this problem, and instead of calling back and having a conversation, at least saying in national television, I'm with you, instead he's ignoring the nurses and taking photo ops. An absolute disgrace. At least in other provinces, you have the premier speaking about nurses and doing all they can to fix the situation and to hear. Here is not the case. Abandoned, crying in national television. My colleague Brigitte yesterday, crying in national television. What is the premier wanting to do? What's the premier wanting to do?
I saw that interview, and it's very difficult because these nurses, you know, they have families too, and some of them are working 16-hour days, double shifting. It's unbelievable, Doris, but...
And needing to find babysitter last minute.
Yes.
Some of them, I had a nurse at 10:30 last night calling me with an 8-year-old diagnosed with COVID that evening. What is she to do? She's not ill yet, but what is she to do? And the premier ignoring us. That's what's so unbelievable.
It sounds very frustrating. If you had the premier's ear right now, Doris, if he was watching, what would you say? Like, what concrete action could he take in the next 24 hours?
Number one, repeal Bill 124 immediately. He has the emergency power to do that. That will send a message. Nurses have been asking over and over and over. Number two, you know, say that nurses, he lumps us with staff. Staff is important. Speak about nurses. Number three, top up the compensation so those nurses that need babysitter can actually not be even more and more and more out of pocket. Number three, fast-track the internationally educated nurses. 15,000 internationally educated RNs waiting for the College of Nurses to be processed. There are 1,000 solutions, Jennifer. The premier is choosing to ignore, and instead he's doing photo ops with empty beds. Empty beds will not take care. He can open all the beds. The next thing also, Jennifer, is we are absolutely distressed that the premier all the time is saying we didn't know, we are doing the best, we are the best province. Let me tell you, we will not have enough ICU beds for children, Jennifer. And we have warned the government, we have said to the government, the level of desperation, I mean, you can hear it. Yes. I'm sending today an open letter to the premier. We decided with my president, Morgan Offord, enough is enough. He needs to respond.
We will continue to follow this story. Doris, I always appreciate you coming on. Doris Grinspun, CEO of the Registered Nurses Association of Ontario. Thank you.